Although sharks are the top predators in our oceans, they're by no means the deadliest marine animal. Despite the fact that 11 people perished in shark attacks last year, it is believed that 50 to 100 people perish annually due to box jellyfish interactions. Many of the deadliest marine animals appear friendly or even harmless, yet appearances can be deceiving. As we reveal the mysteries of the world's most dangerous sea creatures, starting with the less dangerous ones first and working our way up to the truly lethal competitors, be prepared for a few surprises. Hello and welcome back to our channel. In this video, we'll show you the 10 dangerous sea creatures in the world. Let's get started now. Number 10. Sharks. Given how much time we spend in the water together and how infrequently they attack humans, large species like the great white and tiger shark do, however, provide a threat to swimmers, surfers, and divers, particularly when there is low visibility. Most shark attacks are misidentifications that take place pretty near the beach. Attacks that are hit and run are rarely lethal. In the Florida Museum of Natural History's yearly worldwide shark attack summary for 2021, there were just 11 deaths out of 137 shark-human interactions. Number 9. Lionfish. Pteroi, sometimes known as lionfish, has 12 recognized species, all of which may be identified by their spiky fin rays and vivid, alert coloring. Two invasive lionfish species that were once exclusive to the Indo-Pacific are now wreaking havoc in the Caribbean and Mediterranean oceans. The lionfish eats a lot of crustaceans, mollusks, and small fish while having no known predators. The lionfish is in our list of the most hazardous sea species because of its venomous dorsal, anal, and pelvic spines, which scare off the majority of prospective predators. Although lionfish are not aggressive, they do have a terrible neuromuscular toxin in their spine that's similar to the venom of cobras. Tenderness, swelling, and significant damage at the wound site are signs of a lionfish sting. In severe situations, these symptoms might persist for up to 30 days, while they often last only a few hours. Multiple spine stings raise the risk of infection and bring on additional symptoms like sweating, heart rate fluctuations, and abdomen pain. Although lionfish stings are rarely lethal, a person who has received many stings may have anaphylactic symptoms following future envenomation, according to the literature. Number 8. Pufferfish. Off the east coast of South Africa, there are plenty of pufferfish, so we must always be cautious when releasing them. Pufferfish are the second most poisonous vertebrate in the world, despite their almost adorable look. Even though they're only 1 inch long, some pufferfish species are toxic enough to kill up to 30 adult humans. Tetrodotoxin, a chemical found in pufferfish, is 1,200 times more toxic than cyanide. Fortunately, it also stays inside of their liver and sexual organs, not just leaching from their skin. However, it doesn't stop some individuals from consuming them. The Japanese delicacy fugu can only be prepared by professional chefs, despite the fact that many people have tried and failed to do so. 10 people died after consuming self-prepared pufferfish between 2006 and 2015. The hardest aspect, according to certified chef Yoshitaka Takahashi, is making sure the sections that can be eaten are completely clean. Tetrodotoxin, if consumed, results in localized numbness around the mouth, nausea, salivation, and vomiting, but has no recognized antidote. These symptoms typically appear 45 minutes after eating the pufferfish. In extreme circumstances, these symptoms will only worsen, leading to respiratory failure, generalized paralysis, and loss of consciousness. Number 7. Stingray. The stingray, sometimes known as the pussycat of the sea, has an adorable appearance. But ever since Steve Irwin's tragic passing in 2006, everyone has realized just how harmful they can be. The Australian conservationist and television celebrity passed away after the stingray's barb pierced his heart. The venom of a stingray causes excruciating agony and swelling where the incision is, but it seldom results in death. Every year, approximately 1,500 stingray-related injuries occur in the U.S., the majority of which are brought on when a person unintentionally steps on a submerged ray. Sand is used by stingrays to conceal themselves from prospective predators. As a result, it is frequently challenging to perceive them. Your foot will sustain a cut or puncture wound if a stingray's barb catches there. The sheath that encases the stinger contains the venom. If this venom gets inside the body, it can harm muscles and tendons and cause excruciating agony. Although the pain is excruciating, most victims seek medical attention. However, depending on the severity of the injury, some stingray injuries can be treated at home. Number 6. Flower urchin. A deadly toxin is hidden within the flower-like tentacles of the attractive and seemingly innocent-looking predator known as the flower urchin. These tentacles, often referred to as globiferous pedicellariae have the potential to release a toxic substance when disturbed or rubbed. The size of the pedicellariae that deliver the venom influences its efficacy. Any flower urchin sting will be painful and paralyzing. Tsutomu Fujiwara, a Japanese marine researcher, had 7 or 8 flower urchin pedicellariae caught in his finger in 1930. On the spot, he immediately felt tremendous agony, and shortly after that, he started to feel euphoric and have breathing problems. He wasn't able to speak due to the paralysis of his lips, tongue, and eyelids. After around 15 minutes, these symptoms began to fade, and an hour later, all but the facial paralysis remained. The flower urchin, which is regarded as the most hazardous sea urchin in the world, may kill a human, but not with its toxin. Instead, accidental drowning might happen as a result of the incapacitating pain, muscular paralysis, breathing issues, numbness, and confusion. Number 5. Sea snakes. Sea snakes come in over 50 different species, all of which are extremely deadly. Sea snakes will bite if startled or threatened, despite the fact that they're typically timid rather than aggressive. The Dubois sea snake is the most poisonous and carries a strong neurotoxin that impairs breathing and paralyzes the skeletal muscles and diaphragm. Sea snakes have far smaller teeth than their terrestrial siblings, making it possible for a person to be bitten without even recognizing it. They only realize how serious their condition is when the initial symptoms start to appear. Although the total death rate is around 3%, a sea snake bite has the potential to be lethal. The greater the victim's prospects of survival, the faster they will receive expert medical attention and an anti-venom. Number 4. Cone snail. Snails are among the last animals you'd expect to be the world's deadliest marine critter, but these harmless invertebrates have a terrible secret under their patterned shells. Cone snails are found in tropical waters like those in the Pacific and Indian Oceans, close to coral reefs. Cone snails sting their victims to death with a sharp proboscis in their jaws. Then, using a pointed barb on the end of the proboscis, it pulls its prey back towards it. Once the fish is completely immobilized, the cone snail opens its mouth and consumes it whole. Cone snails don't hunt people, of course, but people frequently approach them because of their alluring shells and end up getting stung. According to a report in the National Center for Biotechnology Information, pain or numbness at the incision site are the primary signs of a cone snail sting. As these rapidly get worse, victims will start to experience generalized muscle paralysis, respiratory failure, cardiovascular collapse. If a patient isn't treated, death is swift and frequently occurs within 1 to 5 hours, the NCIB adds. Number 3. Stonefish. The stonefish, the world's most poisonous fish, uses its venom to fend off predators. The stonefish, as its name implies, resembles the stones and boulders that can be found on the ocean floor. It ambushes its prey using its remarkable camouflage, although humans frequently stepped on it unintentionally. When it occurs, the stonefish reacts in a way that could be fatal. It injects venom from the sacs located at the bases of each of its 13 dorsal spines. The pain is excruciating, and within minutes, your foot will swell to a size greater than 3 times that of normal. Immersing the afflicted limb in extremely hot water is the first step in treating a stonefish sting. Following the deactivation of some venom components by this mechanism, an anti-venom can be given. Stonefish stings can result in shock, respiratory issues, nausea, vomiting, delirium, paralysis, and other symptoms, but they very rarely result in death. Number 2. Blue-ringed octopus. Even though it doesn't grow much larger than a golf ball, the blue-ringed octopus has enough venom to kill more than 20 people. The blue octopus gathers its venom on purpose and uses it to paralyze its prey, in contrast to the pufferfish, which doesn't actively employ its venom for anything. The salivary glands of these octopus species contain microbes gathered from the ocean. Tetrodotoxin is released by the bacteria there. The octopus spits venom into its prey after using its beak to break through the shell. This procedure nearly immediately paralyzes its prey. The salivary tetrodotoxin from a blue-ringed octopus will paralyze a human if it bites them, much like it paralyzes its prey. After getting bitten, you'll begin to feel tingling or numbness at the bite site within 5 to 10 minutes. Number 1. Box jellyfish. The sea wasp, or tiny box jellyfish, may kill an adult within 3 minutes, despite being so small that it's hardly visible to the naked eye. The Urokanji jellyfish, one of 51 species of box jellyfish, is just as deadly as its 10-foot-long relative, Chironex fleckeri, despite having an average size of 1 cubic centimeter. According to research on Chironex fleckeri, its venoms are bioactive protein combinations that target several regions of the victim box jellyfish. Another produces powerful muscular spasms that lock the heart into a permanently constricted state, while another causes discomfort attacks the red blood cells, and produces intense muscle spasms. Box jellyfish stings are challenging to treat due to the victim's several attacks. CPR and defibrillators won't be effective because the heart is contracted. What are your thoughts on this? Enter your comments in the box below. Ring the bell and subscribe to our channel to make sure you don't miss any of our upcoming videos. We'll see you in the next video.